lovely introduction by Sandy, and I'm really excited for the opportunity to speak with all of you today. I would love for this to be an interactive lecture, so if you have any questions that come up as I'm speaking, please don't hesitate to speak up. I'm happy to hear from you. There'll be time for questions afterwards as well if you'd like to speak then. I also brought some brochures about cataracts and cataract surgery from the American Academy of Ophthalmology, and my cards as well in case you have any questions and want to reach out after the talk, then I'm happy to hear from you as well. So as she mentioned, I'm born and raised in Toronto, Canada. I trained at McGill University and then the Queen's University, and then finally came to Cornell to pursue a fellowship in cataract surgery and cornea surgery, and then was recruited to stay on as faculty. So I'm an assistant professor of ophthalmology now at Cornell. I always thought I would probably go back to Canada, but I've enjoyed myself so much in the city here, and it was a great opportunity, so I've decided to stay. So when you think of Canada, you probably think about hockey. You might also think about the CN Tower in Toronto, or maybe most famously our maple syrup. But I hope now when you think of Canada, you think of me as well. So the outline for the talk today, we're going to be discussing cataracts and what is a cataract, the development of cataracts. We will speak about risk of fall and injury and how to prevent that. We'll speak about cataract surgery and what it entails. We'll also review different lens implant options at the time of cataract surgery, just a brief overview to give you an idea of what to expect. And then we'll follow up with some conclusions and any time for questions at the end. So the big initial question is, why have your eyes examined? Well, vision will change with aging, that's a guarantee. Many changes are normal. It's a normal part of aging of the eye for the vision to change and for the prescription of your eye to change over time as well. And as you get older, there's also a higher risk of development of cataract, but also other eye diseases as well, such as macular degeneration and glaucoma. And so it's important to have your eyes examined to look for any of these, because some of them can come on without any warning signs, and they can be monitored by your ophthalmologist. And it's also nice to establish a relationship with your ophthalmologist, so if you do need surgery in the future, you know what to expect and you have a good relationship with them. So we do recommend what we describe as the comprehensive eye exam. And so that's an eye exam where you're actually having the pupils dilated so that the doctor can examine the front and the back of the eye as well. And so they'll use some special tools, as in this picture here, to examine the back of the eye to monitor for any other eye diseases as well as cataract changes. Your eye professional will be able to tell you how frequently you should have your eyes examined. It's usually about every 1 to 2 years after the age of 50, but sometimes they might want to see you sooner than that and see you back more frequently initially. So when your eye doctor examines your eyes, they'll have a better sense of to tell you when you need to come back for a follow-up visit. But it's usually every 1 to 2 years. So the big first question, what is a cataract? So a cataract is a clouding of the lens that occurs inside the eye. And it's important to know that this is a natural aging change of the eye. Everybody develops cataracts as we get older. Cataracts do get worse over time, so they continue to progress. We haven't found the kind of magic pill yet to prevent them from continuing to progress and to get your vision back to where it was when we were 20 years old. We know that cataracts will get worse over time. Sometimes they can get so bad and so significant that they can actually cause blindness. And so when we start to see early cataract changes, it's important to follow it going forward to monitor for progression. So this is why the dilated eye exam is extremely important. This is me at the microscope that we use in clinic to examine for cataract changes in the eye. The lens itself is behind the pupil, and you can see here the colored part of your eye is your iris, and then in the center, the hole that is there is the pupil, and so the lens lies right behind the pupil, so it's inside the eye. What the lens does is it helps to focus light into the back of your eye to allow you to see clearly. When we're young, that lens is nice and clear, and as we get older, it starts to get more cloudy. Again, that's a natural aging change of the lens itself, so it happens in everybody. And as it gets cloudy, it starts to dull colors, it starts to dull the vision, and it focuses the light less crisply in the back of the eye, so the vision changes. Not all cataracts are visually significant. We might start to actually see cataract changes in the lens itself before it starts to really impact your day-to-day life. So you might see your doctor and they might tell you that you do have some early cataract, But if you're still able to drive, still able to read, and do activities that you like to do every day, you don't have to have anything done. You don't have to have them removed. However, the cataracts will progress, and eventually they will become visually significant. And these cataracts can interfere with your ability to drive, your ability to read, and also function in doing day-to-day things that you like to do. These cataracts do require surgery to improve the vision. However, it's important to know that cataract surgery won't correct for other eye conditions that you might have. So at your eye exam, your doctor will do a thorough, comprehensive exam and look for other causes of vision loss, such as glaucoma, macular degeneration, even dry eye. So the cataract might be one component of the vision loss or the change in the vision, but it's important for your doctor to examine for all causes, and then they can discuss with you what component of the vision change they think is from the cataract and what might be from other eye conditions that also exist at the same time, and be better able to give you advice about if a cataract surgery is right. So what are some of the symptoms of cataract? Well, there can be many. The most common is cloudy or blurry vision. Now, because cataracts grow so slowly over so many number of years, sometimes it's difficult to really appreciate this. Because it's growing so slowly, it's really difficult to appreciate a change in the vision. But your glasses prescription might be changing, and that often means that the cataract itself is also progressing. So you'll find every 1 year or so you're needing to get an update in your glasses prescription to help you see better. And that's a sign of a progressing cataract as well. Colors will also seem faded, and that's because as the cataract grows, it starts to take on a yellow or a brown tinge to it. And again, that's just a natural aging change of the lens or the cataract inside the eye. Something that's interesting is that Monet painted in a lot of browns and yellows later in his career. And there's been some theories that maybe he had developed cataracts that was causing him to see the whites and the bright colors as more browns and yellows, which often happens. I had a patient just last week after her cataract surgery say, "I never knew how white my kitchen was until after my surgery." So that's kind of interesting. Something that most people comment on as well is poor vision, especially for night driving. They find that they just can't really see at night like they used to, and they don't feel comfortable driving. And when that starts to affect your ability to go out and see friends or to travel or to do things that you like to do, that can be a good reason to have a surgery as well. So the night driving is something to look out for. Some people say that they even get some double vision or some multiple images in the eye, and that's because the light can't be focused as clearly through a cataract lens. So those are just some of the things that you might anticipate to see in terms of changes of the vision as the cataract develops. Again, these symptoms can also appear with other eye conditions, so when you go for your eye exam with your eye doctor, they'll be able to tell you what component is the cataract and make sure that there's no other eye diseases going on as well. This is a great visual to show you something that might be a change with the cataracts as they develop. So the first picture here is normal vision. You can see crispness to the colors. You can see that they're bright. And then the same scene, but with a cataract type change, you can see it's just a little bit more fuzzy on that side. Colors aren't quite as bright either. And so that's what it may look like when you're looking through a cataract. But again, if these changes develop very slowly over time, sometimes it can be difficult to really appreciate those changes rather than when it's a sudden change. So how can a cataract be detected? Well, it's detected through that comprehensive eye exam, as I mentioned. What they will do when you go for your eye exam is test the vision, and they'll likely test it at multiple distances. So they'll test it at distance, and they'll also test your reading vision. And that's because certain types of cataract can affect distance or reading more so than others. And there are different types of cataracts that can grow. We'll get into that later in the talk. Then we'll do the dilated eye exam. So that's the drops that they put in the eye, which makes the pupil really big so that we can actually examine the density or the advanced nature of the cataract. It's usually graded on a scale from mild, moderate to severe, and those changes can be appreciated when we examine the cataract through the dilated pupil. And then again, they'll look for other causes of any other eye diseases that might impact the vision. So there's a number of causes of cataract. One is age, which I mentioned. Everybody gets a cataract as we get older. It's just a natural aging change of the eye. However, some other things can cause cataracts to develop faster than on average or put you at higher risk of getting an earlier cataract or a more advanced cataract. Eye trauma can cause a sudden change in the cataract, and it can cause it to come on sooner than anticipated. Any kind of eye surgery causes the cataract to come on sooner as well. Medications like steroid use, so inhalers, oral steroids that you might take, anti-inflammatories, can sometimes make cataracts grow faster. UV light is also a risk factor. So wearing sunglasses when you're outside to protect the eyes is always recommended, and that's just good for general eye health regardless. And then some diseases can predispose to cataract as well. Diabetes, high blood pressure, and even just your genetics. Some people develop cataracts faster than others. Some people need surgery when they're in their 60s, some people need surgery when they're in their 80s, and it's different for everybody. So that's why it's important to have the eyes examined. So as I mentioned, there's lots of different types of cataracts that can grow. These are just a few pictures to show you what they look like. Not everybody gets the same type of cataract. The first cataract here is a traumatic cataract, so it often forms in the center of the lens, very suddenly. A polar cataract is a cataract that grows in the back portion of the lens, and it's very, very dense and causes a very significant change in the vision. A cortical cataract is the one that often causes a lot of glare, especially when driving. The white cataract here is an advanced cataract. Those are very difficult to remove. We don't like to get them to this point. These are the types of cataracts that you often see in developing nations where they don't have access to eye doctors or early surgery. But occasionally you do see them here in the US in people that have neglected their cataracts for a long time or were too afraid to undergo surgery and let them get very advanced. The aging cataract is that kind of natural browning and yellowing of the lens. And then the last one here is a really cute name. It's called the Christmas tree cataract. And it forms these little kind of multiple crystals that are brightly colored, and it almost looks like lights on a Christmas tree. So again, there's many different ways that a cataract can develop, and it can look many different ways under the microscope. And your eye doctor can tell you how advanced your cataract is when you go for your examination. Just to mention that cataract is actually the leading cause of reversible blindness across the world. As Sandy mentioned, they've done some missions to places like Peru and Vietnam, and most recently Mauritius in the Indian Ocean. And you know, people are waiting a long time for their surgery because they don't have access to medicine. We're very lucky here to be in the US, to have access to eye doctors, to have early surgery, so it doesn't get to the point where it causes blindness. But we still have a lot of work to do worldwide. So what can you do? So your doctor has told you that cataract is developing. There are some options. First thing you can try is just to change the glasses prescription. Sometimes updating the glasses prescription can get you seeing well again while the cataract is growing. As I mentioned, cataracts can grow at different rates. Sometimes they come on quite fast, but sometimes they grow very slowly. And if you have early cataract, but you can still update your glasses prescription and get by doing things that you like to do, like reading or watching TV, you don't have to have surgery. And I always mention that to people. That's really important. You can just update your glasses, come back in about 6 months to a year, and reassess. If the vision is getting worse and the cataract is growing, and your glasses prescription changes again, then you might start to think, is it worth updating the glasses again, or is it time to start thinking about a surgery? But that is an option. We can always just update the glasses and wait until it's advanced enough that you're ready for surgery. Another thing you can try is just to improve the lighting in your house. That helps to improve the contrast. And so again, if you update the glasses and improve the lighting or your environment, that might be enough that you don't need a surgery for at least a few years. You can also try a magnifier instead. Magnifier will help you read. Some of them even have lights on them, so that again can improve the contrast. So that's another option as well. If these things aren't enough and it really is affecting your day-to-day life or your activities, or if your doctor says, you know, the cataract is getting advanced enough that I think we might start thinking about a surgery, then our last option is cataract surgery, and that's to remove that cloudy lens. So what is cataract surgery? So a cataract can be removed to improve the vision, and we remove the cloudy lens, and then we put a clear plastic lens in its place. And that allows you to see clearly through again. We no longer have to wait for cataracts to become ripe or advanced before doing a surgery. That used to be the case because it was a very complex surgery. But the surgery itself is very refined now. The surgery only takes about half an hour to do. It's done with very advanced machines so that we don't have to wait for it to get to be a really advanced cataract before we remove it. I always say to people there's two reasons to have surgery. One is I look at the cataract and say it's ready for surgery, it should come out. because if we wait any longer, it's going to be a more difficult surgery for me to do, and I don't want it to get to that point. Another good reason to have surgery is when you are ready. So when you say, I'm bothered by my vision enough that I would like something done, then that's a good reason for a surgery. Because it's a good and it's a safe surgery. It's actually the most commonly performed surgery across the world, but it's still surgery, and it's surgery on your eye. So I always say, I can tell you when you're ready, but you also have to be ready as well. So surgery is an outpatient procedure. It's done across the street at the hospital at New York Presbyterian. You go home the same day, so you don't have to stay overnight in the hospital. It's about half an hour to do. You're awake for the surgery, but they give you sedation through an IV. It's almost like a colonoscopy, so that you're relaxed, but you're awake. And that's because we have to tell you, look at the light or look here or there during the short procedure. And so we actually need you awake for that. And it's actually safer to not put you under anesthesia and just to give you some sedation so that you're relaxed. So that's what to expect for the surgery. This is me just across the street. So again, when should I have surgery? When the cataracts cause enough change to your vision that you're ready for surgery. And you might feel like it's impacting you performing your job, driving safely, doing activities you like to do, like reading or watching television. So you and your ophthalmologist should decide together when you're ready for surgery. So if you have made the decision for surgery, what will you expect? Well, the first step is to have what we call the pre-operative visit. So at this visit, your eye undergoes a number of measurements. And those measurements tell us what lens implant you would be a good candidate for. Because when we remove the cloudy cataract, we actually put a clear plastic lens in its place. And that allows you to see clearly through again. So we need to do the measurements so we can determine what lens to put into the eye. There is still risk because it's surgery, but all risk involved, so any risk of infection, bleeding, change in vision, need for a second surgery is less than 1% of people. So more than 99% of people have a favorable outcome by having cataract surgery. It's a very safe surgery. So during surgery, the most commonly performed surgery is something called phacoemulsification. It's basically a fancy term for an ultrasound probe that breaks the cataract up into very small pieces, and then we suck out the pieces of the cataract through a very small incision in the eye. The incision itself is only 2.4 millimeters. There's no stitches in the eye after the surgery. The wound is so small that it actually self-seals. So it's a very elegant, very advanced surgery. So the phacoemulsification, or the ultrasound, breaks it up into small pieces, and we suck those small pieces out. Once all of the cataract is removed, we put a clear plastic lens implant into the eye. And so what we do is we leave the shell of the cataract behind, and that shell holds your new plastic lens implant. Again, you go home the same day. We ask you not to press or rub on the eye, just because there's no stitches there, so if you press it, you could open those wounds. But most people do really well. We put a shield over the eye so that you're not tempted to rub it. Immediately after, your vision will be blurry. There's lots of drops before the surgery and lots of bright lights during the surgery as well, so the vision's always blurry right after. And the eye often feels really scratchy or gritty for about a day or two, and that's all normal. That's a normal part of the healing process. But the recovery is actually quite short. Over the next couple of days to a few weeks, the vision improves, and the eye starts to feel more comfortable. In terms of what you can and can't do after surgery, we just say no heavy lifting and no real strenuous activity for the first 1 to 2 weeks. But you're safe to fly, you're safe to go on walks. Most people kind of go back to work a few days later if they're working. So the visual recovery and the recovery itself is quite short. Eye drops will be used after the surgery, and your doctor will be able to go over everything with you in terms of how to use them and what to expect. Now, after surgery, your glasses prescription will no longer be accurate, and that's because when we put that lens implant into the eye, we can actually put a prescription in that lens implant to get you seeing clearly without the glasses. It's quite advanced. The eye is usually fully healed about 3 to 4 weeks after, so after that time, we can actually measure the eye. If you do need a small prescription for glasses, then it's prescribed usually about 3 to 4 weeks after your surgery. Now, up to 30% of people can get what we call a secondary cataract, where a bit of a film grows on the back of that lens implant. It's usually a few months to a few years after your surgery. If that does happen, we can actually polish that film off with a laser in the clinic. So you don't ever have to go back for a second surgery on your eye, which is excellent. And then it's only a 5-minute procedure in the office, and it just polishes the film off that might deposit on that lens implant. but most people do very, very well with that. So what is this lens implant that I keep referring to? Well, you can see here how small it is. This is a little plastic lens implant that's on the tip of someone's finger. So this is the lens that we put inside the eye. So there's a few different options for that lens implant, as I mentioned. So our standard, what we describe as a monofocal lens, is the standard lens. So that's the lens that most everybody gets, that's fully covered. What this does, it can set your eye for one distance clearly. So what most people do is they get their eye set for distance vision clear. So that's like if you're walking down the street and looking up at a street sign or a storefront, if you're driving, if you're at the movie theater and watching a movie or watching TV, that would be clear without glasses. But then you require a pair of reading glasses to see up close, or to use the cell phone or sometimes the computer. You'd need a pair of glasses just to help focus more so up close. But that's your standard lens and your standard surgery. This works really well for people who have worn glasses all their life and don't mind wearing glasses, or don't mind throwing on the readers if they want to look at something up close, and day to day when they're walking around, they can do so free of glasses. So that's a really great option. That's the one that most people get. There are some other advanced lens options which you can purchase if you would like an advanced lens. So these ones aren't covered, and they're a few $1,000s per lens. And that's just because the technology in these lenses is what we call more advanced technology. So there's a lens called a multifocal lens. So rather than being set for one distance, it can actually give you a range of distances without glasses. So it can give you distance vision, it can give you vision at the computer, and also for reading, limiting the need for glasses. So some people really want to get out of their glasses, and this is a good option for them, but there is a cost involved. And then lastly, some people have astigmatism on their eyes. What astigmatism is rather than your eye being perfectly round like a soccer ball, it's more curved like a football. Some people are just born that way, it's just the shape of your eye. But they do have these special astigmatism correcting lenses to really make the vision crisp after surgery. Because if you do have this astigmatism shape to your eye, then the vision will likely still be blurry after surgery, and you'd need a pair of glasses for all distances to make it clear. But they do again sell these special astigmatism correcting lenses. When you go for your pre-op appointment, your doctor will do lots of measurements to tell you what lens implant you would be a good candidate for. So this is just a quick background to let you know it exists. So again, you can go with the monofocal lens, which is the one at the bottom, which can give you one distance clear, so distance vision, but then you'd need reading glasses for up close. You can do that special astigmatism correcting lens to try and limit the need for glasses, or that advanced multifocal lens, which can give you distance, intermediate, and near without glasses. This is what it might look like if you're driving and you have that standard monofocal lens. So you can see in the distance as you're driving, it would be clear. But if you went to look up at your dashboard or at a coffee in your hand, it would be a bit blurred. And you might need a pair of reading glasses to read something that was on the coffee cup up close. The pros of this is that it's the standard lens, there's no additional cost. And if you don't mind wearing glasses, if you're used to doing that, or if you like your glasses, this is a great option. The con is that you'll have to wear glasses for some distances. That special multifocal lens can give you a range of distances. So if you're looking out and driving, it would be clear. If you look down at your dashboard to say read the time, it would also be clear. So that's of great benefit. But the cons is that there's a cost to the lens because it's described as an advanced technology lens, so you'd have to pay out of pocket for it. And sometimes it can cause a little bit of glare or halos when night driving, so that's just one thing to know as well. And if you have some pre-existing eye diseases like macular degeneration or glaucoma, or even sometimes if you have very severe dry eye, we don't actually recommend these lens implants because they can impact the quality of the vision. So the best thing to do is when you meet with your eye doctor to talk about different lens options, you can ask if you're a good candidate for these lenses, and they'll be able to help you make some recommendations based on what you like to do and what your options are. So why have surgery? I think there's a few reasons. One, improve your vision. The cataract will get worse over time. That's just a natural part of the progression of the cataract change. Advanced cataracts are harder to remove. We no longer have to wait for them to get ripe before doing the surgery. It's a very advanced, elegant surgery, and we don't have to wait for them to get very advanced. It's actually harder to remove them if we let them sit for too long to ripen. cataract surgery can improve the quality of your life. I think this is extremely important. It can also help limit risk of fall, and I know this is our fall prevention week, so we will speak about some of the benefits of cataract surgery in preventing fall. And then lastly, having cataract surgery also allows your doctor to better examine your eyes to monitor for other eye diseases that can cause blindness. You can imagine as the cataract gets more advanced over time, it's harder for you to see out through the cataract. It's also harder for your eye doctor to see into your eye to monitor for other eye diseases. So that's another good reason to have a cataract surgery. So improving the quality of your life. So cataract surgery induces improvements in vision, and those improvements in vision have been shown to translate into gains in life, in such as your activities, emotional gains, and even your social life. There's been studies that have also looked at the longevity of life by having cataract surgery, and people often live longer when they have improved vision. So that's another good reason to have a surgery. And then the fall risk. So falls are one of the most frequent causes of visits to the emergency department. Over 25% of people over the age of 65 fall at least once a year. That's extremely high. Falls are the leading cause of visits to the emergency department and a very common cause of hospitalization in people as they get older. Many studies have demonstrated that there's a reduction in your risk of having a fracture due to a fall if you have cataract surgery. One study found that you could reduce your risk of having a hip fracture by 23% by having cataract surgery to improve your vision, which is extremely high. So, improvement in the quality of life, improvement in reducing the risk of falling due to poor vision, all good reasons to consider having your eyes examined and to monitor for cataract and other eye diseases. So what else can you do to protect your vision? Well, wearing sunglasses, as I mentioned, is always recommended. UV light can be damaging to eyes, so I always recommend that you have sunglasses on outside or a hat to help cover the face. If you smoke, please stop. I know there's many reasons not to smoke. Another one would actually be your eyes and your vision. Smoking can lead to macular degeneration, and it can cause loss of vision. So another good reason to stop smoking is for your vision. And then good nutrition is always recommended. We have lots of research studies that show that eating a diet rich in leafy green vegetables and colorful vegetables is extremely important for eye health. And also omega-3s. And omega-3s can be found in salmon, tuna, or flax seeds or flax oil. If you don't eat a lot of fish in your diet, then you can also do an omega-3 supplement. And those can just be found at any pharmacy. So good nutrition is extremely important for eye health as well. So in conclusion, everyone develops cataracts. They're a natural part of aging. Cataract surgery is an elective surgery though, so when you're ready and your doctor tells you that you're ready for surgery, that's a good reason to have a surgery. When you are ready, it can have many benefits, not just in your vision, but it can also improve the quality of the life, longevity of your life, and help to prevent falls in the future as well. I'm happy to answer any questions.